ladies, and welcome to the Sonata patient event. My name is Teresa. I'm the nurse advocate and educator for Sonata, along with Casey, who's also co-moderating with me. We're lucky to have Dr. Freeman here with us this evening, talking about treatment options for fibroids. Dr. Freeman, can you tell us a little bit about yourself?
Hello, my name is Dr. Mala Freeman Kwaku. Most people just call me Dr. Freeman because my name is a mouthful. I've been practicing here in the Charlotte area for the past 22 years, OBGYN. Approximately 3 years ago, I transitioned to primarily gynecology in my own practice, and I've had the opportunity to take care of some wonderful women in the Charlotte area and focus mainly on gynecology at this point. And I see a lot of patients with heavy vaginal bleeding due to symptomatic uterine fibroids.
Perfect, perfect. Thank you, Dr. Freeman. This event is also meant to be an open conversation, so feel free to ask any questions. You can put them in the chat, and Dr. Freeman will answer them at the end of the event. So, Dr. Freeman, let's talk about fibroids.
Wonderful.
Most fibroids are asymptomatic or without symptoms. For the women that do have symptoms, the symptoms are heavy menstrual bleeding, low pelvic pressure. You could have problems with urination, constipation.
I first started having symptoms about 7-8 years ago.
In my early 20s.
Probably 8+ years ago.
4 years ago.
When I first started my cycle at age 14, and they were always horrible.
And some of the stories that women have communicated to me have been otherworldly. They really modify their whole lifestyle as a result of their symptoms.
My symptoms got so bad that I actually had to change careers because I could not continue taking days off of work because I couldn't get out of bed.
My symptoms were so bad to the point I will be in the house a week straight.
It was essentially having my period all month long.
When I was taking sick days because I just couldn't get out of bed, painkillers were not helping.
I don't remember a time when fibroids didn't affect me.
My doctors told me that the best treatment would be most likely a full hysterectomy to treat this.
They offered me birth control pills to help with the bleeding.
I went to several doctors looking for an alternate opinion, and I consistently got hysterectomy being my only option.
Hysterectomy or myomectomy, I believe, is the other option she gave me.
A hysterectomy was my only option.
A hysterectomy. And then they suggested I could take some birth control pills.
Minimally invasive hysterectomy, your recovery is 3 to 4 weeks. If it's done open, it's a 6 to 8 week recovery.
I thought a better option would just be to deal with the symptoms than to have my body parts removed.
There were not any treatments for it.
The Sonata treatment is for women with symptomatic fibroids who want to preserve their uterus and avoid major surgery.
After my Sonata treatment, I saw relief. I wasn't having constant periods every single day.
It just started getting lighter and lighter.
I say about a 75% reduction from what I was used to.
I do not suffer from the pain, the cramping, or the heavy bleeding like I did prior to the Sonata treatment.
I don't have to worry about going anywhere when I'm have my period. I don't have to worry about if it's gonna be an incident like before.
The procedure takes less than an hour typically. Recovery is a half hour to 45 minutes before you're discharged and ready to go home.
I no longer have to carry an extra change of clothes. I don't have to keep anything on my mattress.
You have a chance to actually have this treatment and know that your life can be so much better.
Absolutely, hands down. Investigate it, check it out. I would look at it as a first option.
I know this sounds weird, but I can wear white pants and not be nervous about it.
I would definitely tell them to try the Sonata.
The Sonata treatment is very effective. 95% of the women have a reduction in menstrual flow after 1 year, and 97% would recommend it to a friend.
Look into the Sonata process.
Just give it a chance.
It's a game changer.
I never got to wear tampons before. I can wear tampons now. I believe it's the way to go.
Wow, that is such a powerful video. These are the stories that I hear every day, and I've heard for most of my 22 years here in Charlotte working with women that have fibroids and some who don't know they have fibroids. You know, once they are diagnosed and you sort of ask them, are you having these symptoms? Are you having heavy bleeding? Do you have bloating? Do you have bulk symptoms? Are you having pain with intercourse? And it's almost like this eureka moment that they have when they realize that there's actually a reason for the symptoms that they have, and that the symptoms that they have are not normal. You know, sometimes when you are having heavy bleeding most of your life, you feel like this is just a normal thing and everybody's just doing this, and it's not. So, you know, fibroids are almost ubiquitous. A lot of women have them. I would say the majority of women have them, but they are, you know, smooth muscle tumors. The uterus is a big, smooth muscle. And if anyone has had a baby, you know that the uterus contracts to push the baby out, or the uterus contracts with contractions. And the reason why it does that is because it is this large organ that's made out of smooth muscle. Where fibroids, or sometimes they're called myomas or leiomyomas, are smooth muscle tumors that originate in the uterus. They can be in many different areas of the uterus, inside the lining, inside the wall, sort of, you know, towards the outer aspect of the uterus. They can even be dangling from a little stalk. And they are made out of smooth muscle. And typically they cause bleeding. They cause bulk symptoms depending on their location. They cause frequent urination, pain with sexual activity. And depending on where they are or the size that they are, they can also cause problems becoming pregnant or cause problems with pregnancies, including pain or preterm labor. Most women will have fibroids of all different races, and typically, you know, they may be larger or found more commonly in African-American women, but, you know, a good percentage of women have uterine fibroids, whether they know it or not. And fortunately for some women, a lot of times they're just there. They may be very small, and they may not be causing any problems at all. So we talked about the different locations of fibroids, you know, location, location, and location. And as I grow older in this profession and see more and more women with fibroids, I have learned that depending on the location of the fibroids, they can cause different symptoms. You know, we talk about submucous fibroids, and those are the ones that are usually right inside the uterine wall within the lining. They are the ones that, even if they're very, very small, they can affect bleeding extensively, and women can have very heavy periods with the smallest fibroids, depending on where they are. So those submucous fibroids right under the lining can cause a significant amount of bleeding. Intramural fibroids are those that are in the wall of the uterus, and they can cause, again, abnormal bleeding, bloating, frequent urination, especially if they're behind the bladder. Sometimes if they're in the backside of the uterus, some women have pain with sexual activity, have constipation. And if they're under the surface or the very lining, outer lining of the uterus, they cause bulk symptoms. And some women say, I feel like my uterus, my tummy is pregnant. You can have bloating, you can have discomfort. And so these are the different locations where we find them and the different types of symptoms that they can cause. we talked about the majority of women having them. And this slide shows us that nearly 70% of Caucasian women may have them, 80% of Black women may have them, and this is before age 50. 20 to 50% of these women may experience symptoms, and each year, more than 2 million women may undergo some kind of treatment for fibroids. It's usually genetic. It has other components that cause them to grow, but usually if your mom had fibroids, you may also have fibroids. And so that's something that your gynecologist can evaluate you for when you come in for your yearly exam, especially if you're having any of those symptoms that we talked about. So how do you know if your symptoms are caused by fibroids? I never cease to be amazed by women who may see their primary care doctor and they may have anemia, especially, or a low blood count, and how they will be routed around to GI or gastroenterologist specialists to make sure they're not having some intestinal bleeding before they're ever sent back to their gynecologist. Because when I see a woman who has heavy bleeding, anemia of unknown origin, or they don't know why, prolonged or heavy periods, or, you know, having to take time off of work because they have really heavy or prolonged periods, fibroids are usually the first thing that I suspect. And majority of the time I'm correct that the patient does have fibroids, and oftentimes they don't know. And sometimes, you know, when you come in for an exam, we may have to do tests such as usually an ultrasound is the simplest, most cost-effective study to do. We do that in the office, in my office. Some doctors may do it in their office, or they may send you out for a radiology exam. And depending on the size or the location or the number of your fibroids, you may even need to have an MRI, depending on what the plan of action is going to be to take care of that. Self-care is important. I am, like I said, in amazement at how long most women wait to have their fibroids taken care of or diagnosed. A lot of times women go through the childbearing years, and if they choose to have children, you know, they may have children, they may or may not be aware that they're having fibroids during that time. After the childbearing years, they may have heavy periods. And it's really impressive to me how a woman will wait maybe until her early 40s, mid 40s, until she is finally diagnosed with fibroids or is willing to seek treatment, because now that she's taking care of everybody else, she's ready to take care of herself. And I think that's the point where people get, a lot of women get to the point where they're just, they've had enough. They've had enough of bleeding. They've had enough of discomfort. They've had enough of pain. But a lot of times, what has made them prolong the treatment is that they don't want to have an invasive procedure. You know, they don't want to have surgery. They don't want to be out of work for 3 weeks, 6 weeks, 8 weeks. And a lot of women, for whatever reason, they don't want to lose their uterus. They don't want to have something removed from their body that they were born with, and they just want to keep it. And so if there's anything that can be done to help them with the symptoms that they're having, they want to try that in order to avoid some of those long recovery times, etc. So let's talk about some of the fibroid treatment options. The one thing I love about Sonata coming into play now is that it adds one more tool in our arsenal of how to take care of patients that may not have had that option before. So there's different choices, there's different things that we can do. And sometimes we try to start with the least invasive, such as medications, and we'll talk about some of those, to surgeries, etc., depending on the different options available. So here at the top of this slide, you see there's medical or hormonal therapies. That could be something as simple as some of the medications that you take orally to help shrink the fibroids. There are injections that will help to shrink the fibroids. There may be oral contraception that will help lighten some of the menstrual cycles. Won't shrink the fibroids, but it'll help reduce some of those symptoms. Depending on the location of the fibroids, for instance, if it's in the cavity or right under the lining of the uterus, There is the ability to do an outpatient surgery called hysteroscopic myomectomy, where we use a little device that goes in and sort of, I use the term Pac-Man because I mean, most people, depending on your age, you might not know what Pac-Man is, but it sort of goes in there and just eats the fibroid away. There is uterine artery embolization, where this is done as a radiologic procedure. The blood supply to the fibroids is located and little particles are placed in those blood supplies so that the fibroids will lose their blood supply and shrink. That may require a visit or stay in the hospital overnight because that sometimes can cause pain. And depending on the size of the fibroid and the skill of your physician, you can also have the fibroids removed laparoscopically through little small incisions in your abdomen, or you may have to have a larger incision, such as along your bikini line, or, you know, heaven forbid, along the midline, depending on the size of your fibroids, to remove the fibroids. And then the last thing, which is sort of the last resort, if you don't want to bleed anymore at all and you never want to see fibroids again and you want to have that guarantee, the only thing that we can usually offer you is a hysterectomy, which is removing the entire uterus and usually the cervix and the fallopian tubes. Leaving the ovaries behind is often what we do, and that is to remove the fibroids in the uterus and guarantee that there won't be any more bleeding or fibroids. So, you know, each procedure or each therapy has its own benefits and it has its own risks. You know, as I mentioned, when we talk about medical or hormonal therapy, the birth control pill, for instance, or different types, maybe even a long-acting reversible contraception can help improve your symptoms such as bleeding. But usually over time, they may stop working, especially if your fibroids continue to grow. Some of the oral medications or even the injectable medications that are meant to stop your menstrual cycles or prevent the fibroids from continuing to grow may cause, in the short term while you're using it, menopausal type symptoms, which can be really unpleasant for some women. I mean, most of us want to have menopausal symptoms when we're actually menopause and not when we're in our 30s or 40s. So that can be a little bit overwhelming to take. And some of them also have an effect on your bone density, which can limit the amount of time that you can use them. And some of these medications, when you stop taking them or you stop using them, the fibroids then continue to regrow. So it's really a temporary measure. And sometimes your physician may use those measures to maybe keep you from bleeding in order to save some of your blood in case there's some more, a different surgery or something that's going to be undertaken in trying to prevent you from having a blood transfusion. We talked about hysteroscopic myomectomy, or the device that uses, it's an outpatient procedure that uses a surgical device that is inserted through the cervix and is used to morcellate or make small incisions in the fibroid to remove it. And it sometimes can require general anesthesia. Some doctors can do this in their office, depending on the level of technicality that they're accustomed to in their office. And the fibroids that grow within the cavity or under the lining, the mucosal ones that we talked about, it can treat those, but they also have to be a certain size, because even fibroids that grow inside the uterus or under the lining can sometimes grow too large for this type of procedure. And a lot of times, you know, I'll even counsel some of my patients that due to the size of the fibroid, you may need to have this procedure done more than one time. Either, you know, we do it and we wait a few months and then we do it, or that we're going to do it and maybe even years later, you may need to have this redone. Embolization, we talked about that. Uterine artery embolization is usually done by radiology. It's not done by your gynecologist. They usually start by obtaining an MRI. And the MRI helps locate the location of the fibroids. It can also tell whether they're vascular or they're still continuing to grow and that they have a blood supply, because an embolization procedure requires that the fibroid has a blood supply, which is located with the embolization procedure, and the particles are inserted in the blood vessels that supply the fibroids so that there can be blocked and that the fibroids can begin to shrink. And this can be somewhat painful. I've had some patients have had it done, and some have not had any complications or any problems at all. But I've had a couple that say the first evening after the embolization can be very painful, and that may require an outpatient stay in the hospital overnight, and then maybe even 1 to 2 weeks of recovery at home. With this, fibroids can also come back. And then the laparoscopic or open myomectomy. The laparoscopic myomectomy is where, a surgeon will place a few incisions on the abdomen and use small instruments through the ports to remove the fibroids that way. Or depending on the size of the fibroids, you may need we talked about, a larger incision, either the bikini or midline, which is rare, to remove the fibroids. And it can take up to 6 weeks of recovery at home to recover from that surgery. The same is true with hysterectomy. Depending on the size of your uterus and the fibroids, it may be done laparoscopically by someone with a surgical skill to do that, or it can be done with an abdominal incision, or some doctors are doing them entirely through the vagina. But again, that depends on the size of your fibroids, because they have to be able to be brought through the vagina and almost delivered, so to speak. So if they're very large, that may not be possible. And it does require general anesthesia. It does require hospital stay. And depending on the approach that the physician uses, it may take up to 2 weeks to 6 weeks of recovery time. So the Sonata treatment. The Sonata treatment is groundbreaking, and it has really been a game changer for me in my practice, because what I have found is that there are a lot of women that have fibroids of a certain size who really don't need surgery to remove the fibroids, but you can't access them hysteroscopically or through the vagina with the treatment to shave them down because of where they're located. But the Sonata treatment is able to really locate, but also to treat those fibroids. And for the women that do not want any kind of abdominal incision, and they do not want any kind of, true, what we consider a classic surgical procedure, it's great. It's incisionless. The uterus is left intact. And it says here, it does not involve the removal of tissue. Sometimes you may do the Sonata. We may do the Sonata with a hysteroscopic myomectomy, depending on if there's fibroid in the cavity and we want to sort of shave that down and remove it. But it's absolutely not necessary, and does not necessarily require general anesthesia or an overnight hospital stay. So it's completely outpatient. So here's a little video of the Sonata system. This is the patient. She's in the operating room. We put these pads on, which help transmit energy so that the Sonata handpiece can work. It's inserted through the cervix into the uterine cavity. The end of the Sonata handpiece has an ultrasound probe on it, and it's used to locate the fibroids. So I found things with the Sonata ultrasound probe that I can't even see through a transvaginal ultrasound in the office, because it's that sensitive. And once we locate the fibroid, a probe is sent out, which holds the fibroid stationary, and then the Sonata device comes through there's the needle that goes in and it holds it in place. And then the other probes that deliver the radio frequency energy are placed in the fibroid, and radio frequency ablation or heat is used to destroy the blood supply to the fibroid. And usually when we do this, the probes can be removed. You know, we usually sort of manipulate the hand piece so that we can make sure that there aren't any other areas. And this may be done 2 or 3 times, depending on the size of the fibroid, or even more, to make sure that the entire fibroid is ablated and the blood supply is destroyed. Over time, because the fibroid does not have any blood supply, it shrinks. And because it's shrinking and the blood supply is destroyed, the symptoms that our patients experience, including the heavy bleeding, is greatly reduced. So it says it's available now in Europe, and more than 11,000 women have been treated, but I believe that number's, oh yeah, it was 10,000, and I got to treat the 10,000th person, so the 10,000th patient, so that was very exciting for me. But now we're up to more than 11,000 women have been treated worldwide and counting. And the Sonata has had over 50 articles published in medical journals that is safe and an effective treatment for fibroids. So they look at women, over 147 women were treated and followed for 3 years. And what they found is that 50% returned to normal activity the next day. And I would say that that's a good average, because most of my patients, I tell them that they'll either go to work the next day or the day after that. And I have never had anyone say anything different. 95% have had a reduction in bleeding over a year. So that's really good. When you think about over a year's time, like 100% reduction in your bleeding, that's a significant reduction. And that almost 100% or 94% were satisfied with their treatment at 3 years. And that's really, really impressive. 88% reported they had improved symptoms at 3 years. And so this has really been a game changer in helping women with their quality of life, when you are just spending so much time and so much energy perseverating on, when is my period coming? How do I have to prepare for it? What do I have to take with me to work? What am I going to sit on in my car when I'm driving to work? What if I get up in a meeting and my chair is soiled? You know, we spend a lot of energy worrying about our menstrual cycles and ramifications of our menstrual cycles. So to have all of these different parameters that are made better by this procedure is impressive. And for me as a woman, just something that is just, it's really a joy to treat women with this, because it's just such a game changer in helping us gain so much more time and energy to do other things instead of worrying about our menstrual cycles.
And Dr. Freeman, you are changing their life.
I mean, I can feel it every day. I mean, I think that's the one thing that I have really enjoyed about taking care of women in so many stages of life, being this, I've been in the same practice for 22 years. I mean, I've delivered patients who are now, delivered babies who are now my patients. So it's just crazy. And so I've literally followed so many women along the continuum of their life of childbearing. And now, you know, when they get in their 30s, late 30s or 40s, being able to treat them with some of the symptoms that they're having when they have fibroids, and just allowing them to get so much more of their energy back, so much more of their time back, and, you know, so many other things that we want to do as women besides worrying about our periods. And like the patient said in the video about, you know, wearing white pants, I mean, that's huge. And I often tell my patients the same thing, that, you know, I'm lucky, I'm in menopause, so I get to wear white pants any day of the year. But when you don't have to worry about staining your clothes, or wearing overnight pads, or even some of my patients are wearing diapers to bed because they're bleeding so heavy, and it's cheaper to wear diapers than it is to wear, you know, Depends. It's nuts that we have to do that. And there's treatment for that. And it's just so rewarding when you take someone from having that kind of bleeding to now just wearing a regular size tampon and maybe even not even a pad. It's such a game changer. I hate using that term, but it is really a game changer.
I was gonna say, it's a game changer, so yeah, absolutely.
There's certain words that just describe, and that's
Right.
the best word I can use to describe it.
Right, right.
Yeah.
It says a lot.
Yeah. So this is the website here. It's sonatatreatment.com if you want to learn more about the Sonata system. And what I love about the Sonata website is no matter where you live, there are providers that are providing this wonderful technology to their patients. I'm doing it in the Charlotte area. I've got some wonderful friends here also. So if you are somewhere and you need to find a provider, you can go to the Sonata website and you can see who's been able to get Sonata trained and to help you out.
Perfect. Yes, you can visit the Sonata website and find a physician at the top bar. You can put in your zip code and it will let you know what physicians are in your area, certainly within a certain radius, which I think is very helpful as well.
Yes. Wonderful. They also have a wonderful person that will help you learn about how your insurance covers this. And I find it's covered very well with insurances, which is wonderful because up until maybe the beginning of the year, it was the device itself was considered experimental as far as trying to get it authorized, but the technology that it uses is not experimental at all. And it's a type of procedure that many of us as gynecologists do every day. So it's very easy for a physician to learn how to do it because it involves, some of the same types of maneuvers that we do for other things. But this involves obviously the Sonata, and there's, wonderful folks that come out and help the doctors manage the technology of the machine. So it's a fabulous machine to use, and it's a wonderful technology to use. So.
Absolutely. Well, we have a few questions.
Okay,
We'd
let's
like
try.
to do some Q&A.
Okay.
First question. This patient had a Sonata treatment last year in 2023. It shrinked the fibroid a little, but not as much as she had anticipated. Can she get the treatment again?
I would think so. It may be that when she had the treatment, maybe it wasn't ablated fully. It may have been that the size of the fibroid was very large. I think I may have seen the question sort of pass through. Did she say it was 8 centimeters?
Yes, 8.3.
Yeah, and that's a generous size fibroid. I mean, the Sonata procedure should be able to do fibroids of that size, but that's a pretty good size fibroid, and it may not have gotten all of the blood supply. There's also the possibility that sometimes the bleeding may be partially due to the fibroid and then to other factors as well. So, it may be good to sort of, go back in and talk with your doctor, have some more diagnostic tests done just to see if there's anything else that can be done.
Okay, perfect. My second question, can you still get fibroids? Physicians are telling the patients that they can.
Can you still get fibroids?
Mm-hmm.
Yeah, the interesting thing about the Sonata, up until recently, which I'm so excited about the new upgrade where fibroids of a smaller size will be able to be tackled. Most times we find with women with fibroids, I mean, you may have, several larger ones that are able to be treated, but in the past, if they were smaller, maybe 2 centimeters or less, you really couldn't treat it because those probes that go through the fibroid were of a certain size. There's a new upgrade which allows us to treat the smaller fibroids. So it's not necessarily that the patient may be getting brand new fibroids, which is always a possibility. As long as you're of reproductive age, they can, they're the tiniest little pebble can just start growing. But it may be that the fibroid was too small to be treated in the beginning. And so those 2 centimeter fibroids will eventually become 3 or 4 centimeter fibroids. So, unfortunately, a lot of women that have fibroids have more than one, but a lot of times the smaller ones are not really the problems, but the smaller ones will eventually grow. But hopefully with this new upgrade that we have, we can treat the larger fibroids that are problematic now, and we can also treat the smaller fibroids that are will one day grow and maybe one day become a problem as well, to try to treat as many as we can while we're there.
Perfect, perfect. Another question, can fibroids come out of you during discharge during your period?
Sure can, and I have seen that so many times. It's quite a sight to see. A lot of times I've had patients, and when I was in my first part of my career, I'd have patients. I remember a couple of actually that they kept having watery discharge. And, you know, I did every test known to man, did ultrasound, did this, that, and the other. And maybe the third time, one particular patient came to me and I looked, a fibroid was actually extruding through her cervix. And so we knew that that was a problem. So fibroids, especially if they're in the cavity, a lot of times what happens is they're in the wall of the cavity. And as they grow, they bulge into the cavity. And then as they continue to grow, they dangle from a stalk. A lot of times women will have this pain that's like almost like a labor pain every month when they have their period. And that's their uterus contracting around this fibroid, which I use the analogy of it's like an avocado with the seed in the middle. And your uterus is pushing this thing, trying to push it out. And sometimes what you'll see is just heavy bleeding, constant bleeding, until eventually it pops through the cervix. And so it is indeed possible for a fibroid to come out during your menstrual cycle or even any other time of the month. And I've seen that many, many times.
Perfect. It's almost like you're going through labor almost with the fibroid. Absolutely.
And I ask patients all the time, does it feel like you're going through labor? Especially when I do certain kinds of tests in the office, like a diagnostic, an ultrasound where we maybe put a little fluid in the uterus called a saline ultrasound. And you see a huge fibroid sitting in there like an avocado pit. And I ask them, does it feel like every month you're having, you know, like you're in labor, especially if they've had a baby before, they know what labor feels like. And they'll say, that's exactly what it feels like. And I tell them it's because you've got this big fibroid and your uterus is contracting around it. It's an awful, awful feeling.
Another question, are you able to have a child after this procedure?
Yes, you are able to have a child after the procedure. One of the things that we try to be very careful with, depending on the location of the fibroid, is to not interfere with the lining of the uterus. Sometimes fibroids can be there, and it may be better to resect them while you're there. If you are treating other fibroids within the wall, some fibroids that are in the cavity, you can also still treat them with a Sonata, but you also want to be very careful with the endometrial lining. But it is possible to get pregnant after having a Sonata procedure. We just, there was one study that did show that the women who did have pregnancies after the Sonata were in fact having miscarriages at the same rate as the general population who did not have the Sonata. So it's felt like, you know, the risk is about the same as the general population.
Perfectly. Another, are you currently taking new patients, Dr. Freeman?
I sure am. I sure am. I'm going to practice until the cows come home, and I'm always taking new patients and love seeing new patients. So yes, I am in the Charlotte area.
Perfect. Are there any side effects after having the Sonata treatment?
You know, the package insert and the training that we have lets us know that women should expect obviously some vaginal bleeding, sometimes brownish discharge. Sometimes the fibroid may actually disintegrate and there's a possibility of having pieces of tissue, cramping. I can honestly say that since I've been doing the Sonata procedure, I haven't had maybe one person who complained of heavy bleeding after the next month, but didn't realize that it'll take a couple of months for that for your periods to sort of simmer down. But I haven't had anyone call with any side effects, but those are the typical side effects that we tell patients that they should experience so that they'll know that, you know, if it happens, that's normal.
Perfect, perfect. I have another one here. Is the Sonata treatment painful?
Well, we do it under anesthesia. And so in that, it's not painful. And when the patients go home, I don't give them anything for pain. I just let them tell them to take ibuprofen. And I've not had anyone say that that was not enough. So it's just, you know, I wouldn't say it's painful because most of the patients that I do are anesthetized. But after surgery, you don't need anything more than ibuprofen generally.
What does a fibroid look like when it does come out? Is it big, huge, like a clot, or is it does it resemble something else?
You know, it depends, but most of the ones that I've seen that are coming through the cervix look like a little fleshy red ball. You know, if you look at those little small toy balls that you have and that bounce real high, they're usually about that size. They can be smaller. I think I've had one maybe about as big as that, maybe 4 centimeters, but they're hard because they're made out of smooth muscle and they're very rubbery and firm. And they probably have a lot of, bleeding on the outside. But most times if it's a clot and it's sort of stringy, that may be just a clot, or it could even be a polyp. But most times fibroids are circumferential or round.
Perfect, perfect. I have one question. It's just more of a comment that doctors say with hysterectomy, can she still get fibroids?
Most of the fibroids are in the uterus. You know, fibroids can metastasize or sort of attach to other blood supply. That's very rare. You know, for instance, if you a fibroid can attach to the intestines, but usually if you have a hysterectomy, all of that is removed. So I would say in general, no.
Perfect. And what size of fibroids can Sonata treat? Up to what size?
I think it's up to 8 or 9 centimeters.
Okay, perfect. Let's see what other questions we have here. One wanted to know if it's available in Texas. Absolutely. If you go on the website, find a doctor, put in your zip code, and there will be physicians that are located in your area. Any questions, you could reach out to the nurse advocate with the number that's supplied to you and ask those questions as well. Let's see what other questions we have here or comments.
There was a comment. I'm not sure if I understand the comment.
Most of the time having rare stuff happening, I have a very rare genotype so we matter too. That's just a comment. That is, I think, completes our questions from the audience. Again, if you have any questions, additional questions outside of the webinar with Dr. Freeman, always feel free to reach out and ask any questions moving forward. And we thank Dr. Freeman for sharing her best practices and insight. And also, go ahead, I'm sorry, Dr. Freeman.
She says, was looking for conversation about rare side effects.
Oh, another question came in. Okay.
Yeah, I'm not sure what rare side effects, fibroids can cause all kinds of symptoms. The classic and typical ones we've talked about: heavy bleeding, bulk symptoms, pain, pressure, bloating. But they can cause a lot of different symptoms. They can cause a lot of different symptoms. And, the best thing is if you're having some symptom that you're not sure is due to fibroids, come in and see your doctor, let them do an ultrasound. Anything is possible. And I've seen so many different side effects and symptoms with women who have fibroids. The best thing is just to get some diagnostics done, and your physician will try to correlate and see, does it make sense that the symptoms that you're having are related to the fibroids?
Perfect. I have another comment. I'm located in St. Louis. If I want to come to you, Dr. Freeman, could I schedule and come to you?
You sure could. I have patients that come from Florida, and I have a patient that's come from where's she, in Thailand? She works there, but she comes to see me every year. But I'm sure there's a provider near you, but if you wanted to come and see me, you could certainly do that.
You come from far and wide, Dr. Freeman. This has been very educational, great. I want to thank all of you ladies for taking the time to learn about your options and the Sonata treatment. Dr. Freeman, thank you so much. And on behalf of Gynesonics, have a great evening, everyone. Thank
Thank
you
you so
so
much. This has
much.
been great.
Been a
I've
pleasure.
enjoyed it.
Everyone.